Welcome back to our YouTube channel LabGuru. I hope the last video was useful for you. So today we are continuing with the set 3 hematopoiesis set 3. The first question of this series is which marrow changes occurs after acute hemorrhage? If there is a acute hemorrhage, sudden blood loss, which marrow changes will occur? Our options are option A decreased erythroid precursor, option B increased erythroid precursors, option C increased fat cells, and option D is decreased megakaryocytes. Here the right answer is option B, that is increased erythroid precursors. Due to the acute hemorrhage, huge blood loss, the RBCs will be less, so there will be increase in erythroid precursor to compensate the blood loss by increasing the RBC production. So you can see the erythroid precursor is a process by which the red blood cells are formed. Question number 2 is which marrow cell stage lacks nucleoli but still immature? Usually what happens, once the nucleoli is disappeared, the cells converted into the mature cell. But here it's asking which stage shows there is nucleoli is disappearing. It lacks the nucleoli but still considered as immature cell. So here the options are option A promyelocyte, option B metamyelocyte, option C myeloblast, and option D is monocyte. The right answer is option B, that is metamyelocytes. Metamyelocytes usually lack visible nucleoli but they are considered as the immature cell. You can see in the picture indented nucleus, no nucleoli, and this immature cell without nuclei, considered as the immature cell without nucleoli. Question number 3 is which condition increases thrombopoietin levels? Thrombopoietin TPO. Okay, which condition increases thrombopoietin level? Options are option A thrombocytosis, means increase in the platelet count, option B thrombocytopenia, decrease in the platelet count, low platelet count, option C leukocytosis, increased WBC count, and option D is the polycythemia. Okay, so here the right answer is option B, that is thrombocytopenia. Thrombocytopenia, due to the low platelet count, the thrombopoietin level increases in response to counterbalance the population of the platelets. Here in the explanation, low platelets stimulates the TPO production mainly from the liver and also from the kidney to counterbalance the platelet count in the blood. Question number 4. Which lineage produces basophils? The options are lymphoid lineage, erythroid lineage, myeloid, or megakaryocyte. So here the right answer is option C, that is myeloid lineage produces the basophil. Basophils arise from the myeloid progenitors. You can see here the basophil. Where is the basophil? You can see in the granulocyte basophil, and it is a part of common myeloid progenitor. So myeloid progenitors giving rise to the basophils, neutrophils, eosinophils, monocytes. Okay, and the lymphoid progenitor is giving rise to the lymphocytes, that is T lymphocyte and B lymphocyte, and also the NK cell, that is natural killer cells. Question number 5 is which hematopoietic cell is capable of self-renewal and differentiation? Our options are myelocyte, option B hematopoietic stem cells, option C reticulocytes, and option D is megakaryocytes. Here the right answer is option B, that is hematopoietic stem cells. Hematopoietic stem cells only are the stem cells which have both properties, that is for the self-renewal and also in the differentiation to other cells. Question number 6. Which bone marrow finding is expected in severe bacterial infection? If there is a severe bacterial infection, what we can expect from the bone marrow finding? Options are option A decreased granulocytes. Granulocytes means our neutrophil, eosinophil, or basophil. Option B are fatty replacement. Option C, erythroid hypoplasia, and option D is granulocytic hyperplasia. So, which will be the right answer? The right answer is option D, that is granulocytic hyperplasia. Bacterial infections stimulates neutrophils. Okay, neutrophil is increased in the bacterial infection. So bacterial infection stimulate neutrophils production. That's why the granulocytes means neutrophil, basophil, and eosinophils comes from the granulocytic hyperplasia. Hyperplasia means more cell production. So neutrophils are type of a granulocyte. So option D is the right answer. Question number 7 is, which marrow precursor has abundant primary azerophilic granules? What's the azerophilic granules? It means the white blood cell having granules which is a reddish purple color when we are using or we are staining with the Romanowski stain, having azure 1, azure 2. Okay, so these granules are taking reddish purple color in response when we are staining with the Romanowski stain. So our options are option A, promyelocytes, option B, myeloblast, option C, band cell, and option D is metamyelocyte. Here the right answer is option A, that is promyelocyte. Promyelocytes contains numerous primary granules which are azerophilic in nature. You can see in the picture, these are stained with the reddish purple color when we stained with the Romanowski stain. Question number 8. Which CD marker is associated with megakaryocytes and platelets? Our options are option A, CD3, option B, CD41, option C, CD19, and option D is CD34. Here the CD means cluster of differentiation. So it's asking which CD marker is associated with platelets or megakaryocytes. So here the right answer is option B, that is CD41. CD41, also known as glycoprotein second B type, identifies the megakaryocytic lineage and it is also useful in the platelet adhesion. Question number 9 is, which condition causes increased erythropoiesis due to tissue hypoxia? The options are option A, chronic lung disease, option B, leukopenia, option C, thrombocytopenia, and option D is iron overload. So here the right answer is option A, because due to the chronic lung disease there will be less oxygen transfer and lead to the sustained low oxygen level. Okay, so as we know, due to the low oxygen level, our kidney stimulate to produce more erythropoietin hormone, and erythropoietin will cause the increase in or catalyze the process of erythropoiesis. Question number 10. Which marrow cell has the most condensed nucleus before extrusion? Options are option A, polychromatic normoblast, option B, basophilic normoblast, option C, orthochromatic normoblast, and option D is reticulocytes. Here the right answer is option C, that is orthochromatic normoblast. Orthochromatic normoblast has pycnotic nucleus, very condensed nucleus. You can see in the picture here, see the nucleus is very condensed. So it's also called pycnotic nucleus. Question number 11. Which interleukin promotes differentiation of B lymphocytes? Our options are interleukin 2, interleukin 7, interleukin 3, and interleukin 1. So here the right answer is option B, that is interleukin 7. It promotes the differentiation of B lymphocytes. Interleukin 7 is important for lymphoid progenitor development, and lymphoid progenitor means B lymphocyte, T lymphocytes, these are the lymphoid progenitors. Question number 12. Which hematopoietic stem cells property allows lifelong blood production? The options are option A phagocytosis, option B adhesion, option C self renewal, and option D is hemoglobin synthesis. Which property allowing lifelong blood production for this hematopoiesis cell? The right answer is option C, that is self renewal. Due to this property, the hematopoietic cell allows lifelong blood production because of self renewal. Self renewal maintains the stem cell pool. Question number 13. Which erythroid stage lacks nucleus but still contains RNA remnants? The options are option A mature RBC, option B reticulocyte, option C normoblast, and option D is proerythroblast. So always keep in the mind, if there is a question like RNA remnants, means it is always in the reticulocyte. Okay, reticulocyte contains RNA remnants, but there will be no nucleus. The right answer is option B, that is reticulocyte. Reticulocytes contains residual RNA network. After staining, you can see like this. And that's why after staining with the methylene blue, new methylene blue, these remnants are stained like dark blue color. Question number 14. Which bone marrow component stores iron? Here the options are option A megakaryocytes, option B macrophages, option C lymphocytes, and option D is neutrophils. So here the right answer is option B, that is macrophage. Macrophages, also known as the nurse cells. When there is a breakdown of the RBCs, red blood cells, they reclaim the iron and they store it or release it through developing erythroblasts or hemoglobin synthesis. So they are storing the iron. Okay. Macrophages store iron as ferritin or hemosiderin, which they are storing iron in which form? They are storing iron in the form of ferritin or hemosiderin. Question number 15. Which hematopoietic precursor is first morphologically identifiable in granulopoiesis? The options are option A myeloblast, option B promyelocytes, option C myelocytes, and option D is metamyelocytes. The right answer is option A, that is myeloblast. Myeloblasts are the first morphologically identifiable in granulopoiesis series. So you have to remember these things. Myeloblast is earliest visible precursor in granulopoiesis. Question number 16 is a case-based question. A 25 years old male presents with fatigue and pallor. Blood smear shows microcytic hypochromic RBCs with ring in bone marrow. What is the most likely defect? The main identifying feature is here ring in bone marrow. Options are option A decreased globin synthesis, option B defective iron incorporation into heme, option C increased hemoglobin breakdown, and option D is vitamin B12 deficiency. So the right answer is option B, that is defective iron incorporation into heme. Why it happens? The rings that are showing in the bone marrow are sideroblast. Sideroblast means there is a accumulation of iron in the red cells. So it indicates sideroblastic anemia caused by impaired incorporation of iron into heme. Question number 17 is a child living in an industrial area presents with abdominal pain and anemia. Lab test shows elevated ALA and protoporphyrin levels. Which enzymes are most likely inhibited? So they have provided us the options with ALA synthase only, option B ferrochelatase only. Option C, ALA dehydratase and ferrochelatase. And option D is porphobilinogen deaminase. So here the right answer is option C, that is ALA dehydratase and ferrochelatase. Both are inhibited. We can see in the explanation lead poisoning. As we know, the child is living in an industrial area. So due to the lead poisoning, it inhibits ALA dehydratase and ferrochelatase, causing accumulation of intermediates. So the right answer is option C. Question number 18. A newborn is found to have predominantly HbF, fetal hemoglobin. What is the physiological advantage of this hemoglobin? Option A is decreased oxygen affinity. Option B, increased carbon dioxide binding. Option C, increased oxygen affinity. And option D is reduced iron binding. As we know, the fetal hemoglobin is normal for the newborns. But what is the physiological advantage of this? So here the right answer is option C, that is increased oxygen affinity. Hemoglobin F. Fetal hemoglobin has higher oxygen affinity as compared to the adult hemoglobin, allowing efficient transfer from the maternal blood. This allows the efficient transfer of oxygen from the maternal blood because it has more affinity towards oxygen. Question number 19 is, a patient presents with cyanosis. Cyanosis means the bluish color discoloration of skin or lips or nails, anything caused by insufficient oxygen in the blood. So patient is present with the cyanosis. Blood analysis reveals increased level of methemoglobin. What is the primary abnormality? The options are option A, iron in ferrous form or ferrous state. Option B, iron in ferric state. Option C, reduced globin synthesis. And option D, excess porphyrin production. So the right answer is option B, that is iron is present in ferric state, because methemoglobin contains Fe3+. Because here you can see in the blood analysis methemoglobins are more, so it contains ferric Fe3+ ion, which cannot bind with the oxygen sufficiently, causing the cyanosis, causing the less blood supply to the tissues, so result in the cyanosis. The right answer is option B. Question number 20. A 30-year-old patient present with chronic hemolytic anemia. Genetic analysis reveals substitution of valine for glutamic acid in beta globin chain. Which hemoglobin variant is present? Here the condition is substitution of valine for glutamic acid in beta globin chain. So the options are option A, HbA2, option B, HbC, also called the Cooley's hemoglobin. Option C is HbF, fetal hemoglobin, and option D is HbS, that is the sickle hemoglobin. Here the right answer is option D, that is sickle hemoglobin, because this type of mutation, it's a mutation that is substitution of valine for glutamic acid in beta globin chain. This type of mutation causes sickle cell hemoglobin, okay, HbS. Congratulations, we again finished our 20 questions today. I hope it will help you a lot. See you in the next video. Thank you.